Hello, my name is Dahlia. I will be presenting our timeline for campaigning to get nurse anesthetists to practice independently at the VA hospitals throughout the United States. We will be having public, local, and state awareness and lobbying as the focus of our campaign. We will work closely with the AANA members to initiate active lobbying at the state level, and we will contact VA representatives to set up meetings to discuss our mission and goals. Our main goal is going to be better access to care through CRNA independence of practice. We will be having a contact with current veterans to join our team, and we will have their live testimonies throughout the meetings that we will be holding the week after. We will be initiating meeting appointments with the VA representative for week 2. So on our week 2 timeline, we will be having the meetings with the VA representatives. We will have public hearings as well. We will discuss the evidence-based practice of CRNA history of providing safe, cost-effective care. We will also be having the live testimonies of current veterans and how they have to wait for medical care and surgical care because of shortage of CRNA staff at the VA hospitals. We will add those testimonies to our public meetings and through also social meetings that we will be holding throughout week 2. We will also be initiating social media webpage in order to also have public awareness and any questions and concerns that would be further initiated by our campaign, so for us to address it. So through week 3 to week 6, we will bring forth evidence-based quantitative data on CRNA practice of care through mentioning of the CRNA history, through safe practice, cost-effective. We will bring cases just like the one case that was done by a research organization in regards to 500,000 individual cases completed and supervised by CRNA practice alone and the health outcomes of those cases. We will also be discussing the cost advantage of hiring CRNAs and having more CRNAs to practice at the VA hospitals and addressing the shortage of the anesthesia staff at the hospitals. We will also show more evidence and data along with live testimonies of current veterans. On our last week, which is week 7 and 8, we will wrap up our campaign by summarizing our facts. We will summarize our data, and we will finally present it to our legislator for votings, and we will be waiting for those votes. Meanwhile, we will further address any questions, any concerns on our media webpage or through emails and phone calls. Thank you.
This letter is requesting full support from legislators for certified registered nurse anesthetists to practice within their full scope of education and training. In an effort to expand veterans' access to care, CRNAs should be allowed to practice to the full extent of their licensure. Permitting this would abolish the alarming wait times for needed care that the American veterans presently endure. There is a proposed plan of action with steps that will be taken within the next 60 days aimed at amending regulations to include CRNA APRN full practice authority.
"11 governors in the United States have filed opt-out letters to allow CRNAs to practice to their full extent of their training. President Obama has endorsed a bipartisan Senate bill introduced by Senator Ron Wyden and Scott Brown that would allow states to opt out of requirements of the health care reform law in 2014. The AANA was founded in 1931 and represents more than 52,000 CRNAs and SRNAs nationwide. CRNAs have been providing anesthesia for more than 150 years. CRNA credentialing came into existence in 1956. Anesthesia care is 50 times safer than it was in the early 1980s. CRNAs practice in every setting in which anesthesia is delivered. In 2001, CMS changed federal supervision rules for nurse anesthetists to allow state governors to opt out of facility reimbursement requirements. In 1986, Congress passed legislation for CRNAs to be the first nursing specialty to be accorded direct reimbursement rights under the Medicare program. CRNAs are the predominant providers in rural areas.
We are now going to discuss some of the most frequently asked questions regarding CRNA practice within the VHA system. The first of these questions is, what is the current policy on certified registered nurse anesthetist practice within the VHA? In 2016, the U.S. Department of Veteran Affairs announced that it would be amending regulations to allow 3 roles of VA advanced practice registered nurses. Unfortunately, this amendment did not include CRNAs. The reason stated by the VA is that they do not see a shortage in anesthesia care providers within their system. The next of these questions is there a shortage in anesthesia care providers? Research has been conducted with the aim of forecasting future shortages in anesthesiologists. These studies have found that the estimated shortage of anesthesiologists is expected to grow to 12,500 by 2020. The same study found that there's a projected surplus of about 8,000 certified registered nurse anesthetists in the same time period. The next question is, what are the benefits of allowing full practice authority for CRNAs within the VA system? We have outlined many benefits in this presentation, but the main benefit that we see in allowing full practice authority for CRNAs is the cost savings associated with the implementation of the independent model. The research clearly shows that CRNAs acting independently provide anesthesia services at the lowest economic cost. The next question that we're going to be addressing is there a difference in the outcomes and care provided by anesthesiologists and CRNAs? A review of research has shown that there is no difference in the quality of care provided by anesthesiologists when compared to CRNAs. It clearly states that no definitive statements can be made about the superiority of one type of anesthesia care over another.